September the 10th is World Suicide Prevention Day, and in Nigeria, attempting suicide is still a crime. The law says anyone found guilty could be imprisoned for up to a year. But experts say this must be reviewed to support survivors in getting the much-needed mental health services they need. At the moment, a bill is in the works at the National Assembly to address it. As we mark this year's World Suicide Prevention Day, Just Nigeria's Zina Bala explores stories of survivors and gets experts to wade in on the debate to better serve Nigerians struggling with their mental health. Please note that some parts of the story might be disturbing.
Much like many other African nations, Nigeria has a deeply entrenched conservative stance on mental health. It's one of those issues where simply uttering words like depression, anxiety, or suicidal thoughts tends to send ripples of discomfort through the conversation. Mental health advocates say it's increasingly evident that this topic must no longer be shrouded in silence. Anna Owetere is a 58-year-old civil servant living in Jiwa, a suburb of Abuja, Nigeria's capital. About 10 years ago, Anna experienced an unimaginable tragedy, the loss of her only son, David, to suicide.
When I came back from home, I entered the room. The place was dark. There is no chair. So I was looking for my child. So somebody's leg touched me. When I hold him, I said, oh God, I was calling him. There is no chair there. Those who are around don't know who killed him. Whether it is friend or whether it is people around, I don't know. So I was crying. So they ran down and brought him down. They went and got police. The boy have already, maybe the time they were doing this thing, the boy managed to write something with biro inside his pocket. The police didn't allow me to see the paper. Let me see the paper.
In August 2023, a disturbing incident on 3rd Mainland Bridge in Lagos, Nigeria's commercial capital, captured the nation's attention. A Lagos socialite was on the brink of a fatal plunge into the lagoon when passers-by intervened, saving her life.
Suicide does not jump on people. It starts from stressful events that they are not able to manage, and then it might get them into the point of getting depressed, clinically depressed, and then suicide might now become like an option to them, especially when they cannot find a meaning to their lives again, especially when what used to excite them no longer makes them happy in any way, especially when the triggers around them are pushing them into the point of negativity.
In 2021, former President Muhammadu Buhari signed the Mental Health Act into law. The Act is a significant milestone and a culmination of persistent efforts to replace the outdated Lunacy Act of 1958. Chime Asonye, a mental health and policy expert, played a pivotal role in advocating for the legislation.
In terms of mental health services, establishes 3 new entities. One is the Department of Mental Health. So there is a protocols for mainstream mental health within the Federal Ministry of Health. The second was a mental health assistance committee that has things like psychiatrists, social workers, traditional institutions and faith leaders on there, which is actually a novel aspect of the Mental Health Act in relation to other African countries to protect the rights of those with mental health conditions. It also established a mental health fund to fund and put more finances into the mental health sector.
A 2019 data from the World Health Organization paints a grim picture for Nigeria. The legal framework stipulates that suicide is not a crime. However, attempted suicide is, subject to imprisonment for up to 1 year.
Suicide should be decriminalized because if you have a mental health act and which is supposed to support those who have mental health conditions, individuals are prevented from help-seeking behavior. from going to see their family or for their therapist or their other medical practitioners. They don't want to share their suicidal ideations or behavior because suicide is currently criminalized.
Aisha Buba runs a non-profit organization dedicated to providing access to mental health support through counseling. Her work also involves leading the charge towards a brighter future for mental health in Nigeria.
We supported thousands of Nigerians, and also we created the first radio drama on mental health in Nigeria, where we create awareness about mental health. We in a fictionalized way, we tell stories of Nigerians facing different social issues.
As the calendar turns towards September 10th, Nigeria joins the rest of the world in observing National Suicide Prevention Awareness Day, designated by the World Health Organization to acknowledge those affected by suicide, raise awareness, and connect individuals grappling with suicidal thoughts to vital treatment services. This year's theme, Creating Hope Through Action, resonates profoundly.
Now, if we are backed by policy, government policy, it makes it very easy for psychologists and people in mental health space to have more space to more opportunities to educate people.
Mental health experts advocate for critical government reforms to encourage individuals like Anna's late son David to seek help for mental health challenges effectively. They also stress the importance of evidence-based prevention strategies, responsible media reporting, and providing robust social support at both family and individual levels. Zainab Bala, Gist Nigeria.
The loss of a loved one is always a fresh wound in the heart. Now, what can you do to help yourself if you are struggling with your mental health? Consultant neuropsychiatrist Dr. Memuna Kadiri shares a few tips in our next clip.
You are dealing with all these issues, so you are aware, okay, now what are my triggers? What triggered this issue? What are my stressors? Because if you do not know what your triggers are and your stressors are, you will not be able to manage the situation. When you exercise, it helps to improve and increase endorphin. And because it's a feel-good hormone, you feel happier. Limit exposure, excessive exposure to news and social media. I'm very busy, forgetting that if you die, it's 1 minute silence, and most times it's not usually 1 minute. Connect with a healthy support system. The word here is healthy. Because when you are down that dark hole, these are the people that will pull you up. And when you are up there, they are going to cheer you up. To our men out there, don't let anybody tell you, man up, be a man. It's a woman's thing to cry. You feel like crying? Shed tears. It's therapeutic to cry. There is no excuse for I can't sleep. Women, I'm talking to you right now. Women, you need more sleep and uninterrupted sleep. What I will advocate is more fruits and vegetables. Hey, it's too expensive. I hear you. Come closer, let me talk to you. The truth is, there are fruits in the season every time. There are vegetables in the season every time. So you don't need to break the bank.